It was 6 years ago that a virus completely changed our world. For me, that happened on Friday, March 13th, 2020. I was in medical school, and it was the last day of normal in person classes before everything, including my education, was changed. For many of us, the experience with SARS-CoV-2 was really just the beginning. And many have experienced long chronic illnesses that have persisted for many years since then. As a naturopathic doctor, I've had the chance and privilege to help so many people with COVID, specifically long COVID, as we are seeing this evolve into a very complex but yet individualized health disease process. And I've seen frustration with patients being challenged by not being able to do what they want to do. They feel horrible. Their regular life routine is thrown up in the air. And sometimes they have a hard time just getting through the day. I've been able to experience and see what works and what doesn't work. And I have, as I've pondered the past 6 years of my interface with patients with COVID, both in my medical training and now as a practicing naturopathic doctor, I've kind of distilled those things down into 6 main lessons. Things that I've learned about how COVID impacts us, what we can do about it, how we can stay healthy, and what we can do moving forward to prevent things like this from really taking a toll on our lives. Let's dive in. The first lesson is that your experience with COVID is different than my experience with COVID, and it's different than the neighbor next door. Everyone in my experience has a different experience with COVID, with the SARS-CoV-2 virus and all of the variants that it has had. And because of that, there's really no one-size-fits-all solution in the recovery and treatment processes. There's a lot of factors that go into that. Genetics is part of that. We have these inside stories, as I like to call them, and I've heard them called, from our DNA that kind of predispose our body and how it is going to experience viruses. We have our environment, the food that we eat, the air that we breathe, our lifestyle, sleep, exercise, movement, so much more affects our health. All of those things play a very important role into our experience that we have with any virus, whether it's the flu, whether it's a rhinovirus, the common cold, whether it's the coronavirus that we know as the SARS-CoV-2, the one that caused COVID-19. And everyone experience is going to vary differently. We often, as I'm treating patients, will see patterns of health conditions. A lot of people experience significant fatigue and sometimes respiratory, but oftentimes as this COVID experience has shifted, I'm not seeing as many people with typical like respiratory symptoms that we saw 6 years ago. I'm seeing people with more of a long-term COVID, chronic viral activation, joint pain, cognitive problems, brain fog, just not feeling well. It manifests differently, and it manifests differently over time. And I think as I'm helping patients with COVID, with treating COVID, whether it's acute COVID or a long COVID presentation, I want to really focus on treating the patient, not treating COVID. I'm treating patients. They're the ones that are sitting in front of me. They're experiencing these things from a very complex background. And all of these things play into how we approach it. Ultimately, my goal is to understand what the root cause is. What is causing this individual, my patient sitting in front of me, to react the way that they do? What's going on that might have predisposed them to the current symptoms that they're experiencing? And how can I help calm their nervous system, calm their hormones, their cortisol, so many other things that can make a difference for their health? Lesson number 2. In some ways, the battle over COVID, over these symptoms, is often won or lost before the first symptoms even appear. We see that, I have seen this over and over again, how if someone had a pre-existing condition, the SARS-CoV-2 virus, COVID-19, just made it worse. And it really illustrates how the pre-existing state of our health determines how we individually and collectively experienced COVID-19. And it really is not like pulling new things out of the air. It's really exploiting the vulnerabilities that our body already has in place. There's a lot of things that can exacerbate that risk. Chronic disease, metabolic dysfunction, chronic stress, chronic viral infections can really make a difference. And through a lot of the pathology of this virus, it's exploiting a lot of weaknesses that our body has. Inflammation, immune dysregulation, chronic stress, so many things are affecting how our body responds to it. And really, anything that we're seeing just is amplified by this COVID. A couple of patients that I've seen have experienced this profoundly. I'm seeing them currently for what I think is long COVID and other related symptoms. One person has had really bad rashes after they had a COVID reaction. And certainly I think there's other factors that play into that, and we're working on discovering what those factors are. Another patient of mine has profound dizziness and weakness and kind of dysautonomia. Their blood pressure changes and they don't feel stable in their body. And that was exacerbated and maybe triggered in part by COVID. And so we see that a lot of things that happened in our past influence how we experience the present and will affect how we experience the future. And I think that's true with anything in medicine, but especially with COVID-19. It's a reminder that we are never too late to show to this party of prevention. It's one of the core principles of naturopathic medicine is prevention. There's primary prevention when we're preventing something from happening in the first place. And there's secondary prevention when we prevent something from coming back. And with a virus, we're not always able to prevent it. There's a whole conversation and dialogue about that, especially in the early days of the pandemic. But we are able to prevent ourselves from experiencing those symptoms. And that really comes from that terrain, the pre-existing conditions. We're able to, instead of retrospectively looking, we're able to turn and look forward. We're able to optimize our health, optimize our immune system so that we can feel as healthy and strong as possible. Lesson number 3. True healing and recovery, in a way, requires a toolbox, not a silver bullet. And we often we're looking in the early days of this COVID pandemic that we experienced, starting now 6 years ago. What were the things that we could try that would help? And I think it's fair to say that many things worked for some people and many things worked for other people, and yet some things worked for no one, or for very few people. Everyone had a different experience with it. But yet there are many different things that we can do from a multifaceted, multi-pronged approach as we build out a treatment plan for either acute COVID or for long COVID. It's important to take it slow, to not try to do everything at once. We don't get sick overnight. We're not going to get better overnight. We might feel better, at least incrementally, but full recovery is not going to happen instantaneously, especially if we have pre-existing conditions or risk factors. And also if we are really struggling to overcome challenges in our health. Oftentimes we need a blend of things. Sometimes those things require out-of-the-box thinking. I've seen a variety of therapies play a very effective role. Antiviral medications, support for clotting and blood thinners, anti-inflammatories, in general immune support, nutrients. All of these things play a role in our health. And whether we're talking about COVID or not, or something else, we can remember that there's all these foundational principles, they all tie together. And it's important really to remember that. I'm always reminded of the benefit that oxygen can have as well. We're breathing all that oxygen all the time, but sometimes we need more. Our clinic here has a hyperbaric oxygen therapy chamber where we're able to use high dose oxygen to deliver therapies to really nourish those tissues in the body. It helps to stimulate the immune system, to generate new tissues when needed, to help overcome challenges with circulation, getting oxygen to where it needs to be. We found that to be a success, very effective with COVID. So as you think about your experience with COVID, maybe your present experience with a virus, whether it's COVID or not, or your future experience with a virus, which is probably likely, given the fact that we're all humans living on this planet and there's viruses all around us, we can always build and strengthen our own toolbox to help us have a better chance of success when we are facing those things in the future. We can think about those foundations of health: eating well, sleeping well, moving well, managing stress. Man, there's aspects of fundamental physiology things, lowering inflammation, avoiding foods that we know are not really good for us. There's a lot of mental health things that we can do. Our mind and our body are really connected, and we need to acknowledge that and make sure that they are both in concert with each other. The way that we support our body affects our mind, and the way that we support our mind affects our body. It's really all integrated together. And as we support our nervous system, as we support our immune system, it all works together to help us feel well and to do well. That's the third lesson. And before I go to the next one, if you're finding this valuable, please subscribe and click the bell so that you can receive more helpful videos like this. It helps me know how to better reach you. And also share in the comments, what was your experience with COVID, whether acute COVID or long COVID was like? What's been helpful for you? What's been in your toolbox? And maybe that could help somebody else. Look forward to reading what you have to say. Lesson number 4. We have seen over and over again that vitamin D deficiency plays a significant role in the risk for COVID. And those people who have vitamin D deficiency have a higher risk of getting a more severe form of COVID-19, COVID virus generally, and it's going to be more prolonged as well. Vitamin D is an amazing neurohormone. It's kind of a neurohormone. It's a vitamin. Our body processes it through the sun, but often in our skin. But oftentimes, especially where in Montana, where I live, vitamin D levels are generally always low. I have yet to see somebody here in Missoula who has a normal vitamin D level in their blood that is not supplementing. We need supplementation vitamin D, especially for people in higher climates, higher latitudes, farther north. Vitamin D really helps with the immune system. It helps prevent inflammation. It helps us react appropriately to viruses. And we've seen over and over again that people who have the low vitamin D are not able to respond to those viruses when they come around. So vitamin D is a hallmark part of any antiviral therapy that I give to a patient. Now, it's important to make sure we have optimal levels. We can have too much vitamin D. That is possible. One of the things it can do is it can throw off bone regulation, bone metabolism with calcium and other hormones that affect bone reabsorption and resorption and creation and things like that. It can affect calcium buildup in our arteries, which can be a problem. We can have too much, but most of the time I see patients that have too little. So how do we know how much is too much? What's that magic number? We need to test it. And I often will recommend patients that they go get a vitamin D test. It's a simple blood test. I see it often in the range of $20 to $30. Sometimes there's walk-in labs that offer it. And people are able to go in, get tested, and see where they are. If they're deficient, they can move it up. So, and if you have any questions about that, I always recommend talking with your preferred naturopathic doctor, with your healthcare provider, who can help guide you into what the optimal ranges are. Optimal ranges for me as a naturopathic doctor are going to be different than they are for maybe another allopathic MD, PA provider. But ask them. See what they are, and because those ranges are going to be more customized to you and what your body needs. Lesson number 5 is that our experience with COVID is principally driven by our body's ability to regulate stress. When we say stress, I'm talking specifically about the hormone in our body called cortisol. Cortisol is made by our adrenal glands. It sits kind of in the back on top of our kidneys. And cortisol is our body's way of responding to the world around us. It helps us respond to changes in our environment, including changes inside our internal environment as well as our external. When our blood sugar gets low, our cortisol ramps up to give us some energy to get us going and help us find food, for example. We know that the SARS-CoV-2 virus is a chronic stressor, just like any virus is. Any virus, anytime we get sick, our body is under stress. Cortisol helps respond to that stress. Interestingly, I was looking into some research on this. Influenza, which I'm going to apply, works similarly in here to COVID. The COVID virus blocks the hormone that comes from our pituitary gland called ACTH, or adrenocorticotropin hormone. And that's released by our pituitary gland. It goes in through our blood to our adrenal gland. And if the virus is blocking that hormone, we're going to produce less cortisol. If we have less cortisol, we're not going to be able to respond to the stress that comes along with being sick. And that is one of the main reasons that I see why patients feel often fatigued during an experience with either short COVID, acute COVID, or long COVID, is that their HPA axis, the hypothalamus pituitary adrenal axis, is out of whack. I've seen this time and time again where patients who are coming to me with a long COVID type syndrome will have a very obvious adrenal insufficiency. And I'm not talking Addison's disease. I'm not talking Cushing's disease. I'm talking just low. And maybe it's in an okay range, but still not great low. Our body can't respond to that stress. It can't ramp up the things that it needs to mount that best appropriate response. Cortisol is also anti-inflammatory. Helps our body keep inflammation low. That's why oftentimes during acute inflammation episodes, we take a corticosteroid. And whether that's putting something on our skin, whether that's breathing it in an inhaled format for like a lung exacerbation, whether it's a prednisone or hydrocortisone type thing taken orally, those drugs are really mimicking the effect that cortisol has on our body to lower inflammation. One of the ways that I like to test cortisol is through saliva, because it allows us to track throughout the day where our cortisol levels are. It changes over the day. It does this nice high curve in the morning and goes lower at night. And as we look at those, we can see where people might have lower cortisol levels. I just saw someone earlier today and their cortisol levels were pretty flat. It didn't have that curve. They felt fatigued. They didn't feel great. And if they continue to be low, they're not going to feel great. And they're going to need that extra support. So what does that support look like? It looks like supporting, but not overstimulating the adrenal glands. There's a host of adaptogen herbs that can stimulate our adrenal glands in a very safe, kind of gentle way. They can be pretty strong too. I think about ashwagandha, rhodiola, eleuthero, Siberian ginseng, holy basil, maca can be another one. All of these herbs have really good adaptogen properties, helping boost our cortisol. Sometimes when needed, we can also add in some adrenal glandular to that, some adrenal cortex that can really just give that body some actual tissue to work from, to draw the cortisol from and kind of boost it. I've seen that to work really well with many of my patients. And it's kind of like, the analogy would be to like recharging a broken battery. We need that energy. And the goal is to fix that battery, in a manner of speaking, so that our body can shore up and have the energy it needs to deal with the next big stressor that comes along. Because as you and I know, in life, that stress is certainly around the corner. The last lesson that I've learned from the COVID-19 pandemic is that we can't allow our bodies to fully heal if our body is perceiving that it's in a fight or flight response. If our body doesn't feel safe, we're not going to be able to heal as optimally. We see these viruses that are very, in a way, traumatic to our nervous system. It changes how our parasympathetic, our rest and digest, versus our sympathetic, which is our fight or flight responses work, and often leads to a more fight or flight response. And it can affect the way we perceive fatigue. It can affect the way that our body perceives changes. Sometimes we have a change, and even if it's a good change, our body kind of freaks out. Our nervous system freaks out because there's a change. And we know that consciously, in the front part of our brain, that change is what we want to have happen. But in the amygdala and the limbic system inside the middle of our head, that change is perceived as a big, big threat, even though it's a little one. This little change can throw a big response. We need to help then support our body's ability to calm down, to make it so that so these little changes don't trigger a full army unit in tactical gear and guns pointed. We just want a simple change. And it doesn't require that huge response. And everything we do to help our nervous system relax, to practice mindfulness, to support our vagus nerve, part of our parasympathetic nervous system, is going to help with that. I have a whole video, which I'll link in the description below, about ways of grounding. I invite you to check that out because there's some really good thoughts there. But everything we do to support that nervous system can be really powerful. Those are 6 things that we've talked about that I learned from my experience treating patients during COVID in this long COVID era. Embrace individuality. We're not all the same. So our healing is going to be different. We need to focus on our foundations of health. That includes any pre-existing conditions that we have. Focus on calming those chronic diseases, those chronic illnesses, so that when we get the acute thing, we're not going to freak out as much. We're not going to respond as adversarially as we want to, as our body might otherwise do. We need to use a toolbox of therapies, not a magic bullet. This includes a host of herbs, a host of supplements, pharmaceuticals, sometimes compounded ones used in maybe creative ways, hyperbaric oxygen therapy, and so many others. Prioritize vitamin D, because let's face it, we're probably deficient unless we're living under the sun all the time. We need to support our body's ability to regulate stress, and we need to teach our nervous system to be safe. There's 2 other things that I've learned that I'm just going to add as a bonus. They don't really relate to health, but they're profound to me. That during the COVID-19 pandemic and since then, I've really come to been reminded that people are inherently good. I saw so many people reaching out and helping their neighbors. People that were homebound, people that were confined, that couldn't go anywhere because of the lockdowns and limited travel and masking and 6 feet apart and all of those things that we collectively experienced. People are kind. We're all going through this together. We all have our own experience, but there's good people out there. And lastly, probably the number one thing that I learned is how important family is. As I said at the beginning, when COVID-19 started 6 years ago, I was in medical school, and I was not able to attend classes in person. A lot of the learning that I was doing at that time was lecture-based, so my learning was shifted to an online format. Sitting at home, watching recorded lectures, doing things over video, being by myself, but it allowed me to be with my family. At that time, my kids were 2 and 4 years old. Being home was probably one of the best things that could have happened to me during that time. I know that the COVID experience was different for everybody, but the timing for me and my family was perfect. It allowed me to be home more. It allowed me to be present as much as I could, despite having a lot of schoolwork, a lot of extracurricular leadership responsibilities and so forth. But it made me realize how important family is. We did things together more. We weren't able to be out in the community, at church, at other functions. So we were together as a family, and that was really transformative. And I think as we think about healing, I hope we'll remember the importance that family has. We share those inside stories with our family through our genetics. We share our outside stories, our environment, our exposures, our diet through our families. And all of those come together in medicine. And I've seen that with COVID. I've seen that with so many other things. Might be a bit overwhelming as we talk about this. But as I think about it, I'm continually led and driven by the idea that healing is possible. No matter where we've been, no matter what we've done, we can find healing. Healing might not equal curing. We might not find a cure for a certain disease, But I really do believe that we can find healing, the emotional acceptance, the peace. And we can find healing as we work together, as we think outside the box, as we do all that we can, engage competent medical providers, and do our very best. I really do believe that healing is possible. If you are or someone that you know is interested in diving in a little bit deeper on their healthcare journey, thinking outside the box, visit my website, both my clinic and my personal one. I'll put those in the description below. Reach out. Let me know how I can help support you. And if I'm not able in your area and you want to see someone local, there's plenty of resources available about finding a naturopathic doctor like myself that is local to your area. They have experienced COVID like me and have that robust experience helping patients. And I'm confident that wherever you are in your healthcare journey, that you'll be able to find answers that you're seeking for. Thanks so much for listening. I hope this has been helpful, and I look forward to seeing you on the next video. And until then, be well.